It's my life. Hey everybody, good morning. Thanks for coming back to my channel for another video. Sorry I'm looking so bummy and worn out today, but hey, y'all been seeing me on the grind. Come on, cut me some slack. I want to talk to you guys about some MedPass tips. I have the picture of like some of the notes and stuff that I took on my other phone. If you guys are not familiar with the MedPass, setting up a MedPass, what a MedPass is, or certain things like that, let me know and I'll go through that. I got the phone upside down. Okay. And I'll go through that for you guys as well. Okay. So the first thing, I mentioned it in, I think, one of my last videos, was about the blood pressure medication. So you have the hard plastic cup for for crushed medications that you need to mix with pudding or applesauce or something like that. Then you have your little paper cups. So what I do, I usually use the larger plastic cup. I put in all the person's medications. In the small paper cup, I put blood pressure medications in there, and I just pop it on top. So you don't have to, if the blood pressure is too low, to take the whole cup back and try to dig out, the blood pressure pill or compare which one. You already separated in that cup, so you're already good to go. So that's a time saver. And just aside, it keeps you aware, hey, I need a blood pressure on this person. A good tip I have for patches and treatments, like the border gauze, any of the icy hot patches, fentanyl patches, anything like that, we already know we're going to put the time on those. Like, some places have you put the specific time, some places want you to put the shift that you're working, your initials, and of course the date. Now what I do, I take it a step further, just as a time saver. As I'm pulling that person's meds, I'm going to put you want to put like a R or L, is that treatment going on the person's right arm, left arm. So that's a huge time saver. I also put like RK, like right knee, something like that, because sometimes the aides are getting the patient ready and the patch can slide off, something like that. So you want to know where it came from, where to stick it back, or letting it slips off. So just keep some tape handy. All right, so we talked about the tape, we talked about the patches. Another thing we want to talk about is a clipboard. It's super handy for you guys to have a clipboard. You're going to see meds that are missing. Maybe it's the wrong dose, or you need to verify that med. And another thing too is I use my clipboard as a tray sometimes, because think about it, taking them their medication, sometimes you're taking them water or a mixed drink like a Miralax or like a house supplement or Milk and Mag, like anything like that. So you're taking them in all these things. You only have 2 hands. You're not going to take the pills and stuff them in your pocket and all that. So carry a fanny pack, okay? That way you have all your supplies in there, okay? You have your clip your blood pressure cuff onto your fanny pack. Your supplies are handy. It's less in your hands. When you go in and out the room, you're not like, oh darn, I forgot I got to take a blood pressure, or oh yeah, this person's vitals, or oh yeah, this person on oxygen, I need to check their O2. Everything's already right there with you. Blood pressure cuff, thermometer, your pulse ox, your pens, your scissors for everything, your tape, you're good to go. Okay. Treatments. In the beginning of your shift, go through everything, know what treatments you have to do. Put all those treatments together. Get like a little box, a basket, a container. Put all your supplies for each person that you had treatments for. This way, as you're doing your med pass or whatever, maybe you see a CNA is already in a room getting one person ready. And also let your CNAs know, hey, I have treatments for this person, that person, that person. May not be ready when they're already in there doing it. But the thing is, you'll have everything ready and together. So if you see them, say, oh, hold on 1 minute before you strap up the diaper, wait 1 more second, and you have your whole bag. Now on the plastic, the borders, the gauze, all that stuff, it has a plastic in it or whatever. As you pull your treatment, okay, this gauze, this or whatever is for Miss Betty Davis. On the plastic part or whatever, put Betty Davis room 101, right? Sacral wound. Put that on there, so that way, even if you're in a rush, you can grab, oh, okay, this is all the stuff. Another tip, when you get those treatment supplies, get them twice, get double, because first off, you just want to have extra on hand. And secondly, when you're in a rush or whatever, you could fumble, something can fall. Okay. So have extra of those treatments and stuff like that. Knock out your rooms that have 3 or 4 people in them. And any of your residents, patients, whatever, that are a little harder to deal with, harder to please, constantly on light. Blood sugar supplies. Now, what I do, I use a double or triple cup with the lid. So the big styrofoam cups, I'll stack like 3 of those together, right? And the very bottom, that one, I throw in my my lancets, the prickers. I throw those in. I throw in the lancets and the test strip. The second set of cups, I just have like some bleach wipes and stuff like that. So that's just smushed in. And then the very top, I have like the alcohol wipes, the lancets, the finger prickers, the AccuCheck machine, and then I have the little container of test strips. So that's a time saver for you guys there. When you go in, you're using your clipboard like a tray, right? You have your stack of cups. You may have the medications, everything ready for that person. You're going all in like this. So you're going in with your double, triple stack cup. You have everything out. So you got your blood pressure cuff on you and everything. Hey, let me get your blood pressure. Put the blood pressure cuff on them or whatever. Usually what I do, I use that same finger for that same hand to do the AccuCheck. That's my kind of extra tip to kind of keep things moving along. If you have somebody on an AccuCheck or whatever, do that AccuCheck on the same hand you did the blood pressure. What I do is, once the blood pressure starts to loosen, that's when, immediately after is when I do it. You know what I mean? So that way I'm making sure, I know for sure I'm going to get enough blood. I'm not going to have to re-poke this person or whatever. And having those stacks of cups, that keeps everything moving quickly as well. Another tip that I have as well, while you're doing your med pass, certain things you need to come back for, or somebody might be in the middle of care. So use the timer if you have a smartwatch, if you have like a timer on your phone, whatever like that. Just go ahead and use that. Hit a 5-10 minute timer. So that keeps you on top of things. You're not having people hound you when you're in the middle of care or treatment or a med pass for someone else. About, hey, are you ready for this person yet? Or like you might have somebody on an IV, which I had, and the IV was supposed to run for a half hour. So I just went ahead and set my alarm for 25 minutes. Even though the alarm will beep, but you might not be close enough to hear it. You might be in another room. You might get sidetracked with someone else or something else. You're coming on and you're getting a report. You want to make sure that you're asking if anyone is having any visitors, if anyone's going out for appointments or anything like that, or if they're going out to therapy. And then you want to make sure you go ahead and take care of those people first. You know, a lot of times family and friends, they like to step in. They like to appear as the superhero of the person's care. And all of a sudden they're medical professionals. So if you're comfortable with that, or you have time to deal with that, then go ahead and take care of the people with visitors as you go. If you just want a chance at a smoother med pass, just take care of them pretty much first. My last tip is, during your rounds, during your walk arounds, make sure that you're checking to see if each person has water in their cup. But just let your CNAs know, hey, can you make sure that these rooms get water or whatever. And that helps you on your med pass, because it's annoying when you go into the rooms and stuff and you're like, okay, I know these people have their water. Everybody's supposed to have their water. You go into the rooms and stuff and nobody has water. Nobody has anything to drink. Like, that's real annoying. All right, y'all, so that's the little bit of med pass tips that I have for right now that I'm going to go over. If you guys have any kind of questions, please let me know. Stay safe out here in these streets. I'm gonna try to get in because I see that man that's always pulling his pants down, showing everybody his butt and his wings.